What if your body is trying to tell you something? Something really important. Well, that's exactly what we're diving into today. We're going to decode 8 key warning signs of a brain tumor, because understanding these signals, that's a huge step in taking control of your health. So let me just ask you this straight up. Are you really listening to your body? This is the big question we're going to explore together. The whole point here is to give you the knowledge you need to recognize when something might be off.
All right, so what are we actually talking about when we say brain tumor? Well, it's pretty simple. It's an abnormal growth of cells right there in the brain's tissue. The scary part is that these things can sometimes grow without you even knowing it, which is exactly why it's so critical to understand the potential symptoms.
Now, it's really important to get this straight. Not all tumors are created equal. They basically fall into 2 camps. You've got benign, which are non-cancerous, and then you have malignant, which are cancerous. And the main difference, the one that really matters, is that malignant tumors are life-threatening because they can just invade and take over healthy brain tissue.
Before we jump into the signs, I just want to make one thing crystal clear. All the information we're sharing today has been fact-checked and reviewed by qualified health professionals, so you can be confident that what you're hearing is trustworthy. Okay, let's get into it. The 8 key warning signs. Now, I have to stress this, having these symptoms doesn't automatically mean you have a tumor, but they are absolutely signals from your body that you need to pay attention to. First up, we have sign number 1, and honestly, it's probably the most common one, and something a lot of us just brush off way too easily.
And that is frequent and never-ending headaches. But listen, we're not talking about your everyday tension headache here. These are different. They're caused by the tumor physically pressing on sensitive nerves and blood vessels inside the very tight space of your skull.
So how do you know the difference? Well, these headaches have some specific tells. They tend to get worse over time, they often show up at night or first thing in the morning, and they just don't seem to care about painkillers or rest. They're incredibly stubborn.
All right, let's move on to the second warning sign. This one affects how we communicate and see the world around us. Yep, speech and vision problems. This kind of thing happens when a tumor grows in or just pushes on the parts of the brain that handle communication or process sight. It's like it's causing direct interference with the brain's main command centers.
And what does that interference actually look or sound like? Well, it could be anything from stammering or slurring your words to having a hard time understanding what people are saying. For your eyes, you might notice things are blurry, see double, or even start to lose your peripheral vision.
Okay, sign number 3. This one sounds a little technical, but it's a really important clue for doctors.
It's called a focal deficit. It's basically a medical term for a problem that shows up in just one specific area of your body. You can think of it like a trail of breadcrumbs. So for example, weakness in just your left arm can point doctors directly to a problem in the specific part of the brain that controls that arm.
Number 4 is a sign that can easily be mistaken for something much less serious. We're talking about persistent nausea and vomiting that you just can't explain. When a tumor creates pressure on vital parts of the brain, it can trigger that awful feeling of sickness. And a lot of the time, this symptom will come along with balance problems or a feeling of dizziness.
Now for our 5th sign, which has to do with our physical strength.
Muscle weakness. Now, this is a little different from a focal deficit, which is pinned to one spot. This weakness can be more general. It happens when a tumor spreads into or presses on the larger brain regions that control movement. It's almost like a short circuit, just disrupting the signals going from your brain to your muscles.
Moving on to sign number 6. This one messes with one of our most basic biological functions.
Sleeping issues. Our brain has this incredibly complex system for managing when we sleep and when we wake up. A tumor can throw a huge wrench in that whole system. It might cause insomnia, where you can't sleep, or on the complete opposite end, you might feel just overwhelmingly sleepy all the time. The 7th sign. This one can be one of the most unsettling because it can actually affect the very core of who we are.
Changes in personality. When a tumor messes with the frontal lobe or the limbic system, which are basically the brain's emotion centers, it can cause some really noticeable shifts. We're talking about things like getting irritated really easily, having sudden mood swings, or pulling away from friends and family in a way that's totally out of character.
And that brings us to number 8, our final warning sign, and it's one of the most dramatic.
Seizures. There's this amazing way to think about seizures, like an electrical storm in the brain. It's just a perfect description, isn't it? A tumor can totally disrupt the brain's normal electrical pathways, kicking off this sudden, chaotic storm that can cause convulsions or a complete loss of body control.
So, we've just walked through all 8 of these key warning signs.
The next logical question is, okay, what do I do if I'm experiencing any of this? The answer is simple and direct. Go see a doctor, and do it promptly.
This really lays out the path forward. It all starts with you. You notice the symptoms. Then you take that next step and seek medical attention. From there, doctors will probably use tools like an MRI or a CT scan to get a really clear picture of what's going on inside. And once you have that information, you can have a real discussion about the best treatment options.
When we talk about treatment, there are generally three main paths. Surgery is one, where a neurosurgeon goes in to remove as much of the tumor as they can. Then there's radiation therapy, which uses high-energy rays to destroy cancer cells. And finally, chemotherapy uses powerful drugs to kill any of those rapidly dividing cells. The right path really depends on the tumor size, its type, and exactly where it is.
Okay, as we start to wrap this up, let's just zero in on the single most important message here. You have to make your health a priority.
And here's why that's so important. Early diagnosis is absolutely vital. Catching a potential problem in its early stages just dramatically improves the chances of managing it successfully. It makes a world of difference. And that's why paying attention to those first signals is everything.
So, I'm going to leave you with the same question we started with, but maybe now it'll hit a little differently. What is your body telling you? Your awareness, your willingness to listen, those are your greatest strengths when it comes to protecting your health. Thanks for taking the time to learn with us today.